Hey there, welcome to Health with Samantha DPT. I'm Samantha Holland, Doctor of Physical Therapy, and this video is talking about another diagnosis of low back pain called stenosis. So stenosis means narrowing, and we're talking about the vertebral canal here. Typically stenosis happens in the neck or the low back, and there are two different forms, central stenosis and lateral or foraminal stenosis. So here's a picture of your lumbar spine here. And the lateral or foraminal stenosis is talking about the foramen where the nerve roots come out. So these yellow thick things here are the nerve roots in your lumbar spine, and that's the foramen that it's coming out of. Central stenosis is talking about the central canal of the vertebrae in your low back, and that's where the spinal cord sits. So narrowing is what stenosis is really getting at, and that can happen for a lot of different reasons. Usually it's associated with degeneration of the spine and things called osteophytes in particular, which can be little bony buildups that happen in between the bones that can start to cramp up the space that the spinal cord is sitting in or the nerve roots are sitting in. So with central stenosis, it's also can be called myelopathy if it's actually impinging on the spinal cord, but you'll have more broad neurological symptoms because it's affecting the spinal cord, not a specific nerve root, if you will. So some central stenosis signs would be just general pain and stiffness in the area of the neck or the low back. They can start to become more aggressive in areas of numbness and tingling, dizziness, dropping things, gait abnormalities, loss of balance. These are big issues that really need to be addressed. So if there's compression on the spinal cord, it's not a good situation. It can start to affect bladder and bowel movements, those kinds of things. So this is something that really needs to be looked at by a doctor. Some imaging may be done, maybe a decompression, things like that. More commonly, people have lateral stenosis or the foraminal stenosis, and that's when you have buildup or narrowing along the lateral side of the vertebral column, and that starts to affect maybe one or several specific nerve roots. Now in that situation, if a specific nerve root is affected, you may have that numbness and tingling or loss of motor control or weakness in a specific area based on that nerve root level. So that's when your dermatomes and myotomes come into play. And you may have seen this kind of a diagram before. Here's the dermatomes, and the different colors and numbers represent which area of your skin a specific nerve root innervates. So if a nerve root is affected, you may sense that numbness and tingling in that associated area on your body. Same thing goes for motor control, which is called myotomes. So with central or lateral stenosis, you may have numbness and tingling. You may have some gait or balance or motor function deficits based on the weakness because of the compression of that nerve root. You'll probably have some pain. Another tall tale sign of stenosis is wanting to go into forward bending. And you probably see this more in the older population, but that forward bending, leaning forward, opens up the foramen so that alleviates some of the pressure on the nerve root, and that's more comfortable. So you may find you leaning on a cart in the grocery store, for example, just to open up that space a little bit more. Whereas going backwards or extending adds compression to the foramen, closes that space more, and tends to make your symptoms worse. So that's the basic definition and symptoms of these two diagnoses. One of the best things you can do for yourself is, of course, get examined by a professional, and physical therapy can help. We do traction a lot of the time. We have traction tables that can help separate, safely separate the vertebrae so that there's less compression on the neurological or the nerve structures, and then flexion-based exercise, strengthening the core to help take compression and pressure off of the spine, things like that. There are surgical interventions, of course, if it is to that degree, but I just wanted you to be aware of this diagnosis associated with low back pain. It's usually more in the older population because it's more of a degenerative issue versus a disc is more something acute that can happen with a traumatic incident. Stenosis is sort of a buildup. But anyway, if you relate to any of these symptoms, it would be a good idea to get checked out by your doctor, see a physical therapist, and find some help for yourself. If you have any questions, please feel free to comment and then subscribe and like my page to learn more about different diagnoses all over the body. Thank you.